Renal dietitians support clients with their nutrition while living with chronic kidney disease. Let's explore this role and how a renal dietitian can help you. First of all, what is a dietitian? Dietitians are regulated health professionals who use their expertise in food and nutrition to enhance the lives and improve the health of Canadians. Dietitians use the science of nutrition to help people understand the connection between food and health and provide personalized guidance to meet their needs and goals. Dietitians are trained to use the most up-to-date science and translate it into practical guidance that you can use to make nutritious food choices that are right for you. A renal dietitian is a dietitian that specializes in the nutritional needs of people with chronic kidney disease. They provide patients and caregivers with the guidance needed to make healthy food and fluid choices every day. A renal dietitian is a nutrition professional who helps individuals with chronic kidney disease by guiding them to understand how diet impacts kidney function and the body as a whole. Renal dietitians are involved in all stages of chronic kidney disease. If you have kidney disease but have not yet reached kidney failure, your dietitian can recommend how to eat healthy for your stage of kidney disease, so you may be able to help slow down the progression to kidney failure. If you have progressed to needing dialysis, a renal dietitian can help you to navigate eating well and following recommended guidelines while receiving dialysis. If you have received a kidney transplant, a renal dietitian can help with navigating nutritional guidelines for kidney transplant to help keep their new kidney healthy and functioning. A renal diet supports healthy kidney function for those with kidney disease. Your kidneys are bean-shaped organs below your rib cage on either side of your spine. They perform essential functions like filtering your blood, removing waste through your urine, and maintaining fluid balance in your body. With kidney disease, your kidneys can't filter your blood the way they usually would. This allows too much sodium, potassium, phosphorus, and protein byproducts to build up in your blood. This can worsen your kidney damage and cause your body to hold on to too much fluid. A renal diet can be lower in protein, sodium, potassium, phosphorus, and fluid. It protects your kidneys so they don't have to work so hard. The specific amounts of these nutrients you consume depend on the extent of your kidney disease and if you are on dialysis or not. Keeping track of the nutrients in the foods you consume and their impact on your health may be a challenge. Your renal dietitian can help you keep track of this so that you can remain within your recommended guidelines. Renal dietitians provide education and monitor your levels to make sure what you consume is healthy for your body. Dietary limits may vary from person to person. For example, some people with kidney disease will need to reduce their fluid intake to limit water retention in the body, while others may need to increase their fluid intake. Some people might have consistently high potassium and phosphorus levels in their blood and need to limit foods higher in these minerals, while others may have consistently normal levels and not have to be so cautious with these food sources. Moderate salt intake is the only recommendation that is common to all patients with kidney disease. Nutritional treatment can vary depending on the stage of kidney disease. It may change depending on blood and urine test results, medication, and individual needs. Starting dialysis or having a kidney transplant can also lead to a change in nutritional needs. Because of this, there is no single diet for kidney disease. A renal dietitian can develop personalized plans and recommendations. Renal dietitians assess each patient comprehensively to develop personalized education tools based on their assessment. They will go through each nutrient of importance, as already discussed, and provide detailed recommendations. For example, they will provide specific amounts of recommended daily dietary protein intake. You need protein every day to meet your body's needs. Your recommended intakes vary whether you are on dialysis or not. Renal dietitians will also provide recommendations on the best type of protein to consume. Newer recommendations promote more plant-based proteins as they have more protective factors for overall health. Renal dietitians show you how to include more plant-based proteins in your diet, as well as how to properly consume recommended animal-based proteins and recommended portion sizes. Managing sodium intake is also an important part of managing your chronic kidney disease. When your body has too much sodium, it may start to retain fluid. Excess fluid makes your heart and lungs work harder, and over time, this can lead to heart failure. A renal dietitian will provide guidance on how to lower salt in your diet by helping you identify food sources that are high in sodium, label reading, navigating restaurants, and planning low sodium meals and snacks that still taste great. Potassium and phosphorus are also minerals that are found in a lot of foods we consume on a daily basis. For people with kidney disease, potassium and phosphorus can build up to high levels in the blood and have serious side effects. Renal dietitians will assess your stage of kidney disease, blood work trends, and recommend if you require a dietary restriction in these minerals. If so, they will help you identify high sources in your current diet and recommend alternatives. Fluid may also start to build up in your body, and it may be recommended for you to implement a fluid restriction. A renal dietitian will help provide tips and guidelines for you to stay within your recommended daily fluid requirements. Overall, a renal dietitian will help you put it all together to assist you on how to plan a healthy plate while keeping your renal diet guidelines in mind. Renal dietitians are a wonderful resource for people with chronic kidney disease to help them navigate their personal nutritional recommendations and provide support throughout their stages of kidney impairment.